Hi, I am Dr. S.K. Singh. I did my post-graduation in Ayurvedic surgery, that is MS Ayurveda from Institute of Medical Sciences, Banaras University, BHU. And presently I am working as a director, Sushruta Anorectal Institute, Rohini, New Delhi. So today I am going to talk about anal fistula. Anal fistula is a very commonly seen in the general public, and it presents itself as a small swelling in the anal region. There is a swelling with some pain, and sometimes the discharges like pus or watery discharges may also be noticed. So basically any swelling with or without pain which is located near the anal region, and sometimes the pus or watery discharges are noticed from this swelling, this is a very common indication for anal fistula. This indicates that the problem may be anal fistula. Now we talk about the treatment. This is a common feature of anal fistula. Now we talk about the treatment. The treatments which are available nowadays, there are a large number of options are available, because in modern surgery, if you talk about modern surgery, initially it was fistulectomy which was done, and after that, then since fistulectomy has its own complications like anal incontinence, recurrence of the disease, post-op complications like pain, bleeding, etc. So other options were thought about, and amongst those options which were tried in the past, they are like glue technique was there, the laser was tried, and nowadays it is the VAFT, that is video assisted anal fistula treatment, which is also known as MAFT, as minimal anal fistula treatment. They are being tried. But unfortunately, in all these options, the treatment of fistula has not been very confirmed, that there is no access, because even in these conditions also recurrences are being noticed. Now if we look back towards the surgery in the past years. Now, if you thought about in the past days, in the past 1500 years BC, if we talk about, this disease was there, and this has been mentioned in Ayurvedic texts as Bhagandra. Now, this anal fistula was treated in those days with Kshar Karma and Kshar Sutra Chikitsa. Now, this Kshar Sutra Chikitsa is a non-surgical treatment. This Kshar Sutra therapy is a parasurgical treatment. Usually, it does not require any major surgical incisions or surgical or damage to the tissues. Precisely, what is it in this technique? We have to first define the track of the fistula, and that could be done by MRI fistulogram, or we can, with delicate gentle probing also, we can find out the depth, direction, and the branching pattern of the fistulous tract. Now, once this depth, direction, and branching pattern of the fistula has been defined, then a medicated thread, that is known as Kshar Sutra, that is under local anesthesia with certain equipments, this thread is being placed in the fistulous tract. The medicine which is released from this thread, from this Kshar Sutra, usually debrides the fistulous tract gradually. It clears off all the unhealthy fibrous tissue collections, etc., which are present in the fistulous tract and which are preventing the healing of the fistula. Since if we try to explain the mechanism of action, see, basically thread is a media by which we are delivering the medicines, that is Kshara, precisely in the tract which are existing in the fistula. So with the help of thread, the medicine is reaching to the entire tract, and the medicine is cleaning the tract, and body itself, spontaneous healing is there. Now, the healing rate with this Kshar Sutra is approximately 0.5 to 1 centimeter per sitting. That is to say that once the thread has been placed, the medicine is being released, it is working and debriding the tract, but these medicines remain active for 5 to 7 days, and after that the medicine is finished. So this thread has to be replaced by a new thread at weekly or 10 days interval. Now this system of change, that is what we call as the secondary settings, this continues till there is a final cut through. That is to say, the fistula is, the thread is gradually coming down at the rate of 0.5 to 1 centimeter per setting, and the length of the thread, the loop length of the thread is also reducing, and gradually the thread is coming towards the periphery, and then it comes out with the simultaneous healing which is following the thread. So this is the best way to treat the anal fistula, which does not require any hospitalization or bed rest. You can continue your normal routine activities as usual. Now, so far as the clinical trials are concerned, the thing is that whether this treatment is effective or not, let me tell you, this the clinical trial, the comparison between surgery and Shah-Sutra, this was conducted long back by ICMR, Indian Council of Medical Research, and the clinical trials were conducted at 4 premier medical institutes, including AIIMS, Delhi, PGI Chandigarh, etc. And the ICMR researchers, they have concluded that the Shah-Sutra treatment is more effective and more convenient as compared to surgery in the patients of anal fistula. So this is an unbiased, that if this is being concluded that in whatever type of treatments present nowadays to treat anal fistula, the best therapy is the Shah-Sutra therapy. This is a specialized therapy of Ayurvedic Shalya Chikitsa, Ayurvedic Shalya Chikitsa Paddhati. So this is being done, and I would like, because the masses are not aware about this Shah-Sutra, they do confuse it with Bengali treatment or unethical treatment, which is being commonly seen in the nearby areas also. So this Shah-Sutra is a scientific treatment which has been evaluated scientifically and is a part of Ayurvedic system of medicine and surgery. This has nothing to do with the Bengali treatment. Basically, what is, to my information, Bengali treatment, there is some people are doing it, that they are putting, they are not calling this, the Bengali treatment has not been scientifically evaluated. They used to put the thread and they are simply cutting the tissues with the thread. Every day they are cutting it, and they are putting a pressure. This is basically a mechanical cutting of the tissue, which is unethical, which should not be done, and the best option is of Shah-Sutra Chikitsa. So just for your information, I would have delivered this, I have passed this information to you, and you should like, and I would request you to spread this information about in the masses, so the people who are suffering from anal fistula should get a proper information, and they should get this information that there is an option which is from Ayurvedic surgery, and which is far better than modern surgery or any system existing in the medical science for the management of anal fistula. Thank you very much.